Should you be running if you have soreness after ACL reconstruction surgery? This is one of the most common questions we get asked is as they're returning back to running, they have some soreness, what should they do? And in this video, we're gonna go over all that and a protocol you need to follow in regards to returning back to running. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors. Let's talk about return back to running following ACL reconstruction surgery. One of the biggest milestones that a lot of people are excited to hit, but you want to make sure you're hitting it safely and progressing the right way, because you'll see a lot of people don't progress it the right way and start having pain or issues that linger on and just prolongs the recovery. So when you get back to running, there's several key things you need to make sure you're doing before you get there. So one is you need to be medically cleared by your surgeon. The surgeon looks at tissue healing times, and they also look at your knee range of motion and other little factors, but you need to get cleared by your surgeon first. Then you got to make sure you're passing the right test with your physical therapist. So they cleared you on the tissue healing time zones, but now are you physically able to return back to running? Meaning, is your strength there? Or is your knee in good position to handle the loads? Have you been doing some light jumping and light positions, pre-jogging activities to make sure you have a successful return to running? And we have a great video talking about this in further detail. Click the link in our description below where that really kind of go in on when you should be getting ready to jog and everything. But those are the big ones. You want to first be medically cleared, then physically cleared. And then once you get that, the next step is having a running protocol. So a lot of people were like, oh, I got cleared, I'm just gonna go out for a jog, a 2-mile run or whatever. You gotta have a protocol, and this protocol has to have several stages. And if you guys want us to drop a protocol, comment below, we'll drop that in our next video. But right now, we're gonna talk about within the protocol. So once you have your protocol, there's different stages within that protocol, and then there's different parameters in there, like how much you should be running, time or distance, and how much you should be resting. And if you do well, what's the next step? What we're going to talk about today is the soreness aspect of it, because you are going to have some soreness when you're returning back to running, and you want to make sure you're able to navigate through this. And when it comes to soreness, there's two main types of soreness. One, the muscle soreness, like in your muscles, you'll feel that after working out, or even sometimes after doing dynamic activities. I'm like, oh man, I'm sore in my muscles. The other soreness is in your joint itself. So it's not going to be in the muscle, it's going to be directly in the knee joint. So think about that as more joint soreness, more in the knee joint, and in the muscles, your quads, hamstrings, calves, that's more muscular soreness. Let's break down the parameters of soreness. So we're going to break down the parameters when you're doing your running protocol. So let's just create a hypothetical running protocol. So with the hypothetical running protocol, we're going to have 10 levels. And if you do well on level 1, you progress to level 2, and then progress to level 3, so on and so forth. And you never want to do it back to back, so you're always going to take at least a day off in between. So we'll assume for this scenario, it's a Monday, and you're going to start off with level 1. So to kind of retract, with the soreness, we're going to be talking about joint soreness. And joint soreness, think about the joint. And the joint itself, it's going to feel a little cranky, might even have some swelling, or just feel tight, or just not feel the same. As opposed to the muscle soreness, you touch on the muscle, like, oh, that's sore. Versus the joint, it's more inside the actual knee joint. So going back to that protocol. So we're in level 1, you're going to start your running protocol. So you do level 1, you do your normal warm-up. So before you do all your running, always have a really good warm-up protocol. So you do your warm-up, you do level 1. The next day you're taking off. So remember, you never run 2 days back to back, especially when you're getting back to ACL. So now we're talking about Wednesday. On Wednesday, you have some soreness still, some joint soreness, meaning like your knee joint feels kind of weird, maybe some swelling, and you try to warm up, and the knee just still doesn't feel the same. Because the knee doesn't feel the same, there is some joint soreness, and it's on level 1. On Wednesday, you were supposed to hit level 2, but because you had that soreness in the joint that didn't go away after warming up, that means you're gonna have to take 2 days off, and then you're gonna go back down to level 1. So kind of rephrase that. So guys, Monday you did level 1. Wednesday you're going to hit level 2 based on our hypothetical protocol. But you notice you have joint soreness and it doesn't go away after you warm up. It continues. Then you're not allowed to progress to level 2. You're going to have to go back down to level 1 after you take 2 days of rest additional. So you might not be able to hit running again until Friday. So you're taking those 2 days off. Soreness rule number 2. So we're going back to that scenario. You did level 1 on Monday. On Wednesday, you have some joint soreness during warm up, but when you warm up, the joint soreness goes away. You're like, oh man, my knee doesn't feel as stiff, it feels looser. Then you have 2 scenarios you can do. You can do the conservative route, which we usually recommend just to be safe, which means you're gonna do level 1 again. So the same level that you did on Monday, you're gonna do it again on Wednesday. Scenario 2 is you can progress it. It's up to you guys what you guys decide, but normally we like to be on the conservative side, but I know if an athlete warms up and their knee feels good, they're gonna try to progress it. But that still gives you the green light to progress it because the soreness of the joint went away after doing the warm-up. So just to kind of rephrase it, on Monday you do the run, Wednesday a little sore, but you do a warm-up, a little sore in your joint, you do a warm-up and the joint feels good after warm-up, that gives you the green light to stay the same level, same as Monday, or you can go up another level, but you can run that day. That's the big green light on that one. Because you have the green light, you just gotta be safe on what you choose. Like I mentioned, you wanna be conservative early on because you wanna make sure you're slowly progressing your return to running to make sure there's no hiccups. If you go progress too fast, you might run into some little hiccups down the line and it might set you back as opposed to staying conservative and then slowly progressing injury free. So with this one, really try to play the long game. You're gonna get there, just be safe than sorry. And what we recommend is staying at that same level, feeling comfortable, because at the end of the day, you still had some joint soreness going into that day. Even though it got better, you just don't wanna set yourself up for later on, next week or so, having some continued soreness and then it just sets you back. So better safe than sorry in this scenario for rule number 2. Soreness rule number 3. So this time, let's kind of go back to the scenario. It's Monday, you do level 1, now it's Wednesday. You have some joint soreness, but it goes away after the warm-up, the knee feels better. Then you decide to, let's say, go to level 2 or, stay at level 1, depending on what you ended up deciding. You know how we mentioned in rule number 2, we like to stay on the conservative side, staying more in level 1 before you progress to level 2. But whatever one you decide. But the key thing is the joint soreness went away, but when you were running on that stage, on that level, you started developing some joint soreness during that level. If that happens, then you're gonna have to take 2 days off and either stay at that same level 1 that you were in, or if you went up to level 2, go back down to level 1. So hopefully that makes sense. So the joint soreness starts off, you warm up, feels good, you go through your level. As you're running, let's say, midway, you start developing some joint soreness, the knee feels stiff, it's pissed off, feels a little swollen. Then you're gonna have to take 2 days off and either stay at the same level if you're at level 1, or if you went up to level 2, you were more aggressive, you're going to go back down to level 1. And the whole point of that is that the knee just wasn't able to handle that. So giving it 2 days of rest, really get that knee back into action. Soreness rule number 4. So when it comes to rule number 4, this is muscular soreness. So when you have sore in the muscles, so your quads, hamstrings, calf. So you go through that level 1 on Monday. On Wednesday, you're just sore in the muscles. Then just take one day off and then go back to the same level. So you're not going to progress it. You're just going to go back to the same level. And this is including warm up. So even if you warm up, the muscle soreness is still there, or even if it goes away, take 1 day off and then stay at the same level. So that's more muscle soreness. So 1 day off versus joint soreness, we're going to have 2 days off. And that's different because the muscle, usually recovers faster than the joint itself, and the muscle could handle a little bit more load as opposed to the joint, just really gonna get irritated and make things worse. That's why we always use 2 days of soreness for joint soreness, and then for muscle soreness we only use 1 day off there. All right guys, so the last one, soreness rule number 5, and that's no soreness, best case scenario. So with no soreness, you do level 1 on Monday, you go to warm up on Wednesday for level 2, you feel good, that means you can really progress to level 2. No setbacks, and that's the big one. When there's no soreness, no joint soreness or no muscle soreness, you can progress to that level. And always refer to whatever running protocol you have. We just created a hypothetical situation or protocol of 10 levels. Usually, sometimes we stick to the same level for a whole week, then progress it, but there's different parameters, meaning like the speed, you can switch it up. That's why we just threw one. But the big thing is if you have no soreness, that's the green light. When there's soreness and it doesn't go away with the warm up, that's a red light. You don't want to progress. And if there's a soreness but that goes away with the warm up, that's like that yellow light, be cautious. So those are the big things when it comes to soreness. And then differentiating between joint soreness in your knee joint itself, swelling, irritation, versus muscle soreness, like you worked out. So once you guys get these soreness guidelines, this is really going to help you progress through your running protocol. So if you guys have any questions or you guys want us to make a video on a running protocol, comment below. But make sure you have a running protocol. Make sure you're cleared by your doctor to begin running, and make sure you're cleared by your physical therapist doing several tests to return back to running. If you guys like this video, hit the like button, subscribe to our channel, share this video with friends and family or other people that are going through the ACL rehab. If you guys have any questions or need help with your rehab, comment below or send us an email. We work with people in Southern California and in Los Angeles area specifically, and also online. But we are the Basketball Doctors. Let's ball for life.